Look at the modern landscape of mental health. The quiet, comfortable room of a clinical therapist. The deep, empathetic understanding of depression, anxiety, and panic attacks. The multi-billion-dollar global infrastructure dedicated entirely to healing the trauma of the human psyche. When you picture the dawn of this humane, rational approach to the human mind, who do you picture? You are taught to revere the European Enlightenment. You are told to picture 18th-century French doctors heroically cutting the chains off patients in Parisian asylums. You are taught to picture Sigmund Freud sitting in his refined 19th-century Viennese office, listening to his patients and miraculously inventing the concept of talk therapy. We are taught that for centuries the world was trapped in a dark age of superstition, believing that mental illness was caused by demons, until the brilliant, rational minds of Europe woke up and invented clinical psychology. But the absolute foundational blueprint for clinical therapy was not drafted in Paris. The psychological diagnosis of depression was not discovered in Vienna, and the concept of healing the mind through rational conversation was not invented during the European Enlightenment. The exact clinical and institutional architecture of modern psychiatry was engineered over 1,000 years earlier by a Muslim physician working in the highly advanced medical centers of the Middle East. This is the buried record, and today we are peeling back the layers on the psychiatric heist and how a 9th-century Muslim polymath actually invented modern therapy. What follows is the story of a massive medical cover-up and one of the most blatant acts of academic identity theft the Western psychological establishment absolutely does not want you to know. If you are the kind of person who refuses to accept the heavily curated, highly sanitized historical narratives handed to you in school, if you want to know the actual, hidden architects of the medical world, you are in the right place. Hit subscribe. We dig into buried records like this every single day. Let us begin with the official timeline of the human mind. The version of psychological discovery you were tested on, which meticulously paints Europe as the sole, undisputed savior of human sanity. According to the Western narrative, the story of mental health is a brutal, agonizing journey from dark superstition to European salvation. The textbook openly admits that, for the vast majority of its history, the West was utterly terrified by the human mind. In medieval Europe, if you suffered from severe clinical depression, a panic attack, or schizophrenia, you were not viewed as a patient. You were viewed as a monster. The European medical and religious establishment universally believed that mental illness was the result of literal demonic possession, witchcraft, or a direct punishment from God. You did not get a doctor, you got a priest. You were subjected to horrific, agonizing exorcisms. In many cases, the mentally ill were simply burned at the stake. When Europe finally stopped burning them, they began locking them away in nightmarish, disease-ridden dungeons. The most infamous was the Bedlam Royal Hospital in London, commonly known as Bedlam. Inside these European asylums, the mentally ill were stripped naked, chained to the freezing stone walls, and regularly beaten. The Western approach to mental health was so profoundly barbaric that asylum wardens in London actually charged the public an admission fee to walk through the halls and mock the screaming patients for entertainment. The standard textbook narrative tells us that this horrific nightmare paralyzed human empathy until the miraculous dawn of the European Enlightenment. Suddenly, in the late 1700s, the West claims absolute authorship over psychiatric salvation. A French physician named Philippe Pinel supposedly walks into the Parisian asylums, demands that the chains be removed, and declares that these people are not possessed by demons, but are suffering from medical diseases. A century later, the narrative reaches its undisputed climax. Sigmund Freud and the European psychoanalysts invent the concept of sitting down with a patient and treating their mental trauma through conversation. The West completely crowns itself. Europe boldly declares that the concept of psychological empathy, clinical rationality, and humane psychiatric care is the pure, unadulterated invention of the European mind. They draw a straight, unbroken line from the dark ages of the dungeon directly to the pristine therapist's couch, completely ignoring a massive, glaring, 1,000-year gap in the timeline. But if you actually dig into the historical archives, if you look at the physical medical institutions of the ancient world, and if you read the clinical diagnostic manuals written centuries before Freud was even born, that beautiful, isolated narrative of Western psychological genius completely shatters. To find the true father of clinical psychology and the original inventor of talk therapy, we have to completely abandon the torture chambers of medieval Europe. We have to travel back in time, over a millennium before the European Enlightenment even began. We have to travel to the beating heart of the Islamic Golden Age in the 9th century. In the 800s, while London and Paris were chaining their citizens to dungeon walls, the Islamic world was operating on a completely different plane of medical and spiritual reality. The Islamic Empire was building massive, sprawling, state-funded hospital complexes called Bimaristans. These were not primitive clinics. They were highly organized, multi-departmental medical universities. And inside these Bimaristans was something the Western world would not see for another 1,000 years. A dedicated, heavily funded psychiatric ward. The Islamic medical establishment completely rejected the European superstition of demonic possession. Guided by the Quranic principle that God had created a cure for every disease, Islamic physicians viewed mental illness exactly the same way they viewed a broken bone or a fever, as a medical condition that required clinical diagnosis, rational treatment, and profound empathy. Into this highly advanced medical ecosystem stepped a brilliant polymath and physician named Abu Zayd al-Balkhi. Al-Balkhi was not just a medical doctor, he was a master of the human condition. He looked at the medical practices of his time, which focused heavily on physical anatomy, and he realized there was a massive, glaring omission. He realized that doctors were obsessed with the diseases of the body, but they were completely ignoring the agonizing diseases of the mind. In the 9th century, al-Balkhi sat down and wrote a groundbreaking, world-altering medical manuscript titled Sustenance of the Soul. This was not a book of poetry or mysticism. It was a rigorous, highly detailed clinical diagnostic manual. And in the very first chapters of this book, al-Balkhi became the first human being in recorded history to explicitly, scientifically, separate the illnesses of the body from the illnesses of the psyche. He coined the term Tibb al-Ruhani, which translates directly to spiritual and psychological medicine. He stated with absolute medical clarity that just as the physical body can suffer from fevers and infections, the human soul and mind can suffer from anxiety, sadness, and panic. He wrote that if the psyche is sick, the body will lose its joy in life, and physical illness will inevitably follow. He had explicitly defined psychosomatic illness 1,000 years before Western psychology claimed to have discovered it. But al-Balkhi did not just define the concept of mental health. He began to systematically categorize and diagnose specific psychological disorders with a level of clinical precision that is absolutely terrifying to the modern Western narrative. He was about to clinically diagnose depression, map out the mechanics of a panic attack, and invent the exact therapeutic blueprint used in every modern psychiatric office today. Inside the pages of Sustenance of the Soul, al-Balkhi achieved something that shatters the entire timeline of Western psychiatry. Centuries before the European medical establishment even possessed a vocabulary for mental health, al-Balkhi clinically categorized depression. He did not just describe a vague sadness, he explicitly divided depression into two distinct clinical types. He identified reactive depression, which is triggered by environmental factors, such as the loss of a loved one, financial ruin, or severe trauma. And, astonishingly, he identified endogenous depression, a biological, internal imbalance of the brain and body that occurs for no external reason. He mapped out the physical symptoms of severe anxiety. He explicitly described the mechanics of a panic attack, the racing heart, the shortness of breath, the overwhelming sense of impending doom. And he proved that these severe physical reactions were being generated entirely by the mind. But his absolute greatest medical breakthrough was not just the diagnosis, it was the cure. If a patient in medieval Europe was suffering from severe depression or mania, the doctors would subject them to horrific physical treatments. They would bleed them, purge them, starve them, or beat them to drive out the supposed demons. Al-Balkhi looked at these physical treatments and deemed them completely useless for illnesses of the mind. He argued that if the disease is psychological, the cure must be psychological, and so he invented the blueprint for modern psychotherapy. He prescribed something he called spiritual therapy. He explicitly instructed physicians that they must sit down with the patient, listen to their fears, and use rational conversation to guide them out of their trauma. He demanded that the therapist must build up the patient's internal psychological defenses, teaching them how to reframe negative thoughts, recognize irrational fears, and manage their anxiety before it escalated into a panic attack. He was literally describing cognitive behavioral therapy. He was writing the physical manual for talk therapy. He was utilizing the exact clinical psychology that Sigmund Freud would claim to have miraculously invented a staggering 1,000 years later in Vienna. And al-Balkhi's brilliant theories were not just confined to a dusty book. They were physically manifested in the massive Islamic hospital system. If you walked into the psychiatric ward of a Bimaristan in 9th century Baghdad, Cairo, or Damascus, you would not find chains, dungeons, or torture. You would find an environment explicitly engineered to heal the human psyche. Patients were treated with absolute clinical dignity. The wards were designed with flowing fountains because Islamic physicians understood the calming neurological effect of moving water on a panicked mind. They utilized music therapy, employing professional musicians to play specific, mathematically calculated rhythms designed to lower anxiety and elevate the mood of severely depressed patients. They prescribed specialized diets, sunlight, and quiet gardens. And most importantly, the patients sat with trained physicians and talked through their mental anguish. They took the chaotic, terrifying mysteries of the human mind and subjected them to rational, empathetic, clinical science. So, a massive, terrifying question emerges for the defenders of the European Enlightenment. If the clinical diagnosis of depression, the invention of talk therapy, and the creation of the humane, state-funded psychiatric ward were all established, documented, and actively practicing in the Islamic world in the 9th century, how did European men like Philippe Pinel and Sigmund Freud get all the credit? How did the West successfully execute this massive medical cover-up, claiming they invented clinical psychology out of thin air in the 18th and 19th centuries? To answer that terrifying question, we have to completely dismantle the myth of the isolated European medical awakening. We have to look at the massive, highly organized, and deliberately obscured medical extraction network of the Middle Ages. You were taught that the European Enlightenment was a closed intellectual loop. You were told that in the 1700s, Western doctors simply woke up, looked at the mentally ill rationally, and spontaneously invented human empathy. The Western narrative violently insists that the architecture of modern psychiatry is a purely European invention, completely untainted by the outside world. But the physical and geographical reality of the medical world destroys that myth completely. During the Crusades and the gradual conquest of Islamic Spain, European scholars, knights, and merchants flooded into the Islamic world. When they encountered the massive, highly advanced Bimaristans, they were utterly stunned. They saw psychiatric patients being treated with medicine, music, and therapy, while their own countrymen back in Europe were being chained to asylum walls and burned at the stake. They witnessed a medical reality that was centuries ahead of anything the West possessed. European scholars furiously began translating massive Arabic medical encyclopedias into Latin. The physiological and psychological treatises of Islamic polymaths like Ibn Sina, known in the West as Avicenna, and al-Razi, known as Rhazes, flooded into European medical universities. The entire foundational medical curriculum of Europe for over 500 years was heavily dictated by translated Islamic texts. The knowledge of psychosomatic illness, the intricate connection between the mind and the body, and the absolute necessity for humane medical treatment was not invented during the European Enlightenment. It was actively imported. But the Western academic establishment had a major, terrifying ideological problem. They had built an entire imperial identity based on the absolute supremacy of the Christian European mind. They were aggressively colonizing the globe, claiming to bring light and civilization to the backward East. They could not publicly admit that the greatest, most advanced, most empathetic medical science in human history was actually engineered by the very Arab Muslims they were trying to conquer. So, they engaged in a deliberate, highly calculated process of academic erasure. When Western medical historians compiled the definitive timeline of psychiatry, they executed a massive, deliberate historical blind spot. They drew a straight, unbroken line from the ancient Greek philosophers directly to the European Enlightenment, completely skipping over the 1,000 years of highly advanced, heavily documented Islamic clinical psychology. They took figures like Abu Zayd al-Balkhi, a man who had literally written the world's first physical manual on cognitive behavioral therapy and clinical depression, and relegated his work to obscurity. This massive, highly successful historical erasure set the perfect stage for the ultimate medical heist. By the time the 18th and 19th centuries arrived, the West had completely convinced itself that they were the undisputed pioneers of human empathy and rationality. Let us look at Philippe Pinel, the legendary French physician universally worshipped by Western textbooks as the father of modern psychiatry. We are told that in the 1790s, Pinel heroically walked into the horrific asylums of Paris, demanded the chains be struck from the patients, and declared that mental illness required medical treatment, not torture. Western history treats this as a miraculous, unprecedented leap in human evolution. But Pinel was not inventing the concept of humane psychiatric care. He was simply agonizingly late. He was merely dragging European medicine out of the Dark Ages and catching up to a medical reality that Islamic hospitals had perfected and normalized 900 years earlier. Unchaining a patient is not an invention. It is the bare minimum of human decency that the Bimaristans of Baghdad and Cordoba had established as mandatory medical law in the 9th century. Now, let us look at the absolute pinnacle of Western psychological mythology, Sigmund Freud. We are taught that Freud's invention of psychoanalysis and the talking cure in 19th century Vienna was a completely isolated, uniquely Western intellectual miracle. We are told he was the first doctor to realize that repressed trauma, anxiety, and internal neuroses could be physically crippling, and that rational, guided conversation could heal the mind. But if you actually look at the clinical mechanics of Freud's talking cure, the illusion of an entirely new science completely evaporates. The fundamental realization that the psyche dictates the health of the body, and that a physician must sit down, listen, and use rational conversation to dismantle a patient's internal fears, is the exact, fundamental concept of Tibb al-Ruhani, spiritual and psychological medicine, that al-Balkhi established a millennium prior. Freud did not invent talk therapy. He did not discover psychosomatic illness. He simply popularized the exact clinical blueprint that an Arab polymath had already written, packaged it for a European audience, and passed it off as the spontaneous invention of the modern Western mind. The Western pioneers of psychology were undeniably influential, but they were not pioneers. They were the inheritors of a massive, heavily translated, highly advanced Islamic medical architecture. The Western medical establishment did not invent clinical psychology. They simply stopped torturing their patients, finally adopted the basic principles of Islamic psychiatric care, and then had the absolute arrogance to claim they had invented the very concept of mental health. They built the modern therapeutic world on a stolen blueprint. Today, we live in a world completely dictated by the pursuit of mental wellness. We build massive, multi-billion-dollar psychological institutions. We normalize therapy. We rely on the clinical diagnosis of depression, anxiety, and panic disorders to navigate our daily lives. We sit in university psychology classes and nod along as professors praise the unique, unparalleled, isolated genius of the European medical awakening. We are told that the West alone crawled out of the darkness of superstition and figured out how to safely navigate and heal the human psyche. But the modern psychological mind was not born in an 18th century Parisian asylum. The clinical diagnosis of depression was not discovered on a 19th century Viennese couch. The absolute foundation of talk therapy and humane psychiatric care was entirely awakened, shaped, and permanently defined by a Muslim physician in 9th century the Middle East. Modern psychiatry is not a spontaneous European miracle. It is a massive, highly successful medical heist. The West didn't invent the psychiatric ward. They simply walked into an Islamic hospital, copied the clinical manuals, finally unchained their own citizens, and then convinced the rest of the planet that they had invented empathy itself. Everything you just heard is documented. The massive, undeniable physical reality of al-Balkhi's 9th century manuscript, Sustenance of the Soul, is sitting right there in the historical archives. The exact, flawless clinical articulation of endogenous depression, panic attacks, and talk therapy centuries before Europe even understood the concept is an undisputed historical fact. The undeniable existence of the humane, music-filled psychiatric wards of the Islamic Bimaristans, while Europe was conducting exorcisms, is a matter of absolute physical record. The question isn't whether it's true. The question is, why is the true father of clinical psychology and the inventor of modern therapy deliberately kept out of your textbook? If this completely shattered how you see the history of mental health, the birth of psychotherapy, and the myth of Western medical supremacy, share it with someone who needs to hear this. The buried record demands the truth. Subscribe, and we will keep digging.